Hello. I'm going to talk about the leadership skills questionnaire and answer some of the questions for this blog. I chose the article Collaborative Transdisciplinary Team Approach for the Dementia Care Patients by Galvin, Valos, and Zweig. And it reads that interprofessional teams are best when working with patients. I believe this to be true on my unit as we all work for the common goal of each patient. We rely on each other's departments' expertise to meet the plan of care for our patients, and our hospital uses a collaborative care model to ensure we are all working together. Another benefit of collaborative care outside of working together is we are able to educate patients and families in a more unified manner, and occasionally are able to make a quicker discharge for the patient because we all see the final destination and can work together to meet those needs. On the leadership skills questionnaire, I score a high range on the administrative and interpersonal skills, which actually tied for 23 points. And then I scored 1 point less, 22 on the conceptual skills. I believe this to be true based on my experiences as a charge nurse and a floor nurse. I enjoy encouraging staff to work together and leading them to new skills and goals, such as getting admissions and discharges done in a timely manner, and also try to encourage the staff to join a committee to get more involved in our unit and in the hospital. I don't mind completing necessary forms to get the job done, and I attempt to resolve conflict as soon as it arises, whether it's with patients, families, or staff. I always try to use resources and staff wisely and utilize the advice of each team member and other disciplines and staff, which will better care for my patients. I admit I occasionally don't see the big picture and focus on what is right there at hand, or I don't see the big picture because I'm too busy focusing on what's right there at hand. So I do question a lot of the orders that I have as a nurse, the diagnosis, our plan of care, and sometimes I do question the facility organizational goals. In comparison to Grower, Murray, and Langston's skills discussed, I believe my strengths lie in organizing and planning, directing and coordinating. I don't see my leadership skills as controlling, and I try not to approach anything as controlling. For example, if I'm a charge nurse and I have to go into a patient's room, I always introduce myself as one of the nurses that's part of the team. I don't identify myself as the charge nurse every time unless there is a major conflict and it's not being resolved and they ask for the charge nurse, and then sometimes I'll say, well, I am the charge nurse, which is kind of going around what I should be doing, but I just don't feel like I'm any higher than the rest of the team. Staffing is pretty easy for me as our schedule's already laid out who's supposed to be working. I just have to organize where the staffing is going to work, and sometimes I do have problems actually getting that all together and making sure it's kind of fair, so to say, to all the staff. The published literature that I would use would include past facility surveys, and to be able to say how this surveys had benefit our unit, whether it's in regards to falls or Foley care, IV care, and infections. So I would use those surveys to drive my plan of care, and also use it as to how it's been managed before and why it would be effective to manage it that way now. Patient surveys would be helpful to see where patients felt like our strengths and weaknesses lie, and to be able to give that feedback to the staff and say, well, this is why we're doing it, because our patients benefited more from it or saw we worked better as a team when we took this approach. Our unit is a stroke unit, so I would use stroke surveys to coordinate our care. In a patient assignment, we actually use stroke research in regards to how we provide care to our patients, and national data for stroke as well, and it tells us how we coordinate our care. And then tons of medical journals on disease processes and diagnosis and treatment of care. We could reuse those resources if we need to. In addition to our policies within our facility. As far as collaboration, we work with a lot of teams, interdisciplinary teams, including the case manager, the doctors, therapist, pharmacy, all of those to help coordinate our care and to provide better care within our unit. We do this because if case management is able to find a place for discharge for our patient, then we can all work together for the common goal and ambulate our patient, check oxygen saturations, check any kind of behavioral issues, and make sure we modify all of those so they're appropriately placed in the right facility once they're finished. Last, I feel like our whole structure as a hospital is a horizontal structure. We really build our hospital and teams on lateral, horizontal structure that we work together for a common goal. We do have the horizontal leadership as well, but I truly believe they see themselves as us, and in the way they approach us and put policies out and talk to us and work with us. I feel like the patients actually mostly are the ones that have the horizontal structure, where they see the doctors as the highest, and sometimes what we say and do doesn't amount to anything unless we ask the doctor and get the doctor's okay or consent, so to say. Even though we already have it, the patients want to hear it from a horizontal perspective. And I think that's it. Thank you.